name is Dr. Patricia Pimentel Selassie, and I'm a naturopathic doctor out here in Brooklyn, New York. And many of you have been wondering, what exactly is a naturopathic doctor and what kind of training does a naturopathic doctor get? Basically, it means that I went to a 4-year accredited medical university post-baccalaureate program where I learned all the same basic sciences and clinical skills as a medical doctor, but in addition, I learned about different modalities of healing, which mostly consist of natural therapies combined with modern medical research. And a lot of these modalities are centuries old, ancient use of natural herbs and roots. That's under the umbrella of herbal or botanical medicine. We also use homeopathy, another modality of medicine, as well as looking at our diet and nutrition. That actually comes first. And we also use nutritional supplementation, which means vitamins and minerals being used therapeutically to help the body. Other therapies that you might see with other naturopathic doctors are body work and manipulation, hydrotherapy, which is using water for curing and healing. Naturopathic doctors also believe in a certain philosophy that includes 6 principles. And the first and most important principle that we go by is first, do no harm. We never ever want to cause harm in our patients. That's the first principle. That's the first rule that we follow. If, for example, my patient is constipated, I'm not going to go right to a laxative or, God forbid, start doing a surgical procedure or send them for a surgical procedure. The first thing I might tell them is, well, drink more water because you're dehydrated, and that'll get your bowels moving. So first, we do no harm. Second, we believe in the vis medicatrix naturae. The vis medicatrix naturae basically is Latin for stating the healing power of nature. So we know that the body can heal itself, and it's our position as physicians that if we give the body the tools it needs to heal, then the body actually will go towards healing. Okay, the third principle is find the cause. So you never want to look at a kidney and say, well, let's treat the kidney, let's make that kidney work better. We actually really have to look at why the kidney isn't working. Is there blood pressure problems that are blowing through those arteries in the kidney? Is there a sugar problem where a person is a diabetic and the high blood sugar is ruining the kidney and the tissues of the kidney? We always want to find the cause, and when you can address the cause, then the person will actually heal rather than just having a band-aid put on their problems or their symptoms. Another principle is docere. Docere means the doctor is teacher. So we don't want to just see you and write our remedies down on a prescription pad and hand you that piece of paper. We actually want to empower our patients so that our patients can heal themselves. They can know what they need to eat. They can know what medicines they can take to get better, and that they can actually understand what is happening, what type of disease process is happening in their body, and we want to empower them with tools so that they can do that. So education is a must for us as naturopathic doctors. We always want to educate our patients and let them know what's happening with them and their bodies. Another principle is prevention, because this one is simple. An ounce of prevention is worth more than a pound of cure. It's so much easier to teach someone a healthy lifestyle and have them remain healthy than it is to cure them once they're ill or once they're sick. The last principle is basically treat the whole person, and I touched on this a little bit before. Did I touch on this one? When you want to look at the whole system, you don't want to just look at a kidney, you don't want to look at an eye, you want to understand what is happening in this person's body. So those are the 6 principles of naturopathic medicine. I think I got them all. It's first, do no harm, the vis medicatrix naturae, the healing power of nature, docere, the doctor as teacher, prevention. Prevention is, an ounce of prevention is worth more than a pound of cure, and treat the whole person. So if you want to see a naturopathic doctor, I also suggest that you want to make sure that that naturopathic doctor went to an accredited university, and I suggest you go to the AANP, which is the American Association of Naturopathic Physicians.org, AANP.org, to find a naturopathic doctor who is fully educated. A lot of people out there they might be a health coach or a holistic teacher or holistic doctor, but they're not a naturopathic doctor. And you want to make sure that if you want to use naturopathic medicine for you and your life and your family's life, that you find a real naturopathic doctor. Okay, and that would be at aanp.org. If you want to see me, I would really love that. Let's stay connected. Please sign up for my video blogs and my newsletters at brooklynnaturopath.com. Thank you.